Hello everyone, I am Kayla F. Lingwahe, and today I'll be performing immediate newborn care return demonstration. Newborn requires essential newborn care to minimize the risk of illness and to maximize the growth and development. So prior to the conduct of the procedure, I have performed hand washing to deter the spread of microorganisms that may cause disease and contamination. And also, I have prepared the necessary equipment that I need, and this includes the weighing scale, the cotton balls soaked with cleansing solution. I also have a sterile gauze pad, a tape measure, thermometer. I also have a um, vitamin K eye solution and a scissors and kidney basin. I also have a cord clamp, and also I have a baby's clothes, which includes mittens, shirts and bonnets. I also have my sterile water and alcohol. Next is I'm going to identify the infant's identity by using the name tag or the wristband. Also ensure the infant's comfort by making sure that the environment is warm. And also the cold infants in cold environment lose heat through convection, evaporation, and radiation. Next is I am going to proceed on weighing the infant right here. So prior to this, I already weighed the exact fourth clamp that is attached on the umbilical cord of the infant, and I am going to deduct its weight from the exact weight of this infant right here. Next is I am going to proceed on cord dressing. First, I am going to wear my sterile gloves. Next, after wearing the sterile gloves, I am going to properly restrain the upper and lower extremities of the infant. Next is using the cotton balls that is soaked in a cleansing solution. Disinfect the infant's umbilical cord from the base to upwards. It should be 3 times from the base upwards. Next is I am going to place a sterile gauze pad on the base of the umbilical cord. Place it on the base of the umbilical cord. Now, grab the clamp and clamp the umbilical cord about 1.5 inch from the base of the umbilical cord. Now grab the scissors and cut about 0.5 centimeters above the umbilical clip. And express the remaining blood using the sterile gauze pad here. Then discard. Then grab another sterile gauze pad and place it on the base of the umbilical cord, and pour a 7% alcohol on the above of the umbilical clump. Then discard. Next is I am going to proceed on vitamin K injecting. So vitamin K is helps the blood to clots and thus preventing serious bleeding. And also vitamin K is important for the infant since newborns does not get enough vitamin K from their mother during pregnancy. So what I'm going to do is to withdraw exact amount of vitamin K on the ampule and inject it on the third lateralis of the baby. Next is I am going to proceed on getting the anthropometric measurement of the infant. First on the head circumference. It is 17 centimeters. Next on the chest circumference. It is 34 centimeters. Next in the abdominal circumference. It is 26 centimeters. And lastly on the length of the newborn. So it is 43 centimeter long. Next is I am going to measure the temperature of the baby and rectally. So it is 37 degrees Celsius. Next is I am going to proceed for the initial bathing. So next is I am going to proceed on initial bathing. So by doing that, hold the infant or the newborn by football drape manner, and the folding both ears, and carefully washes the head of the infant. Assuming that I have water here. Carefully wash the baby's head. Then use a baby's soap or mild shampoo. Then wipe the baby's head. Including the face. Then after that, dry out the baby. Now after the initial bathing, remove the gloves, the wet gloves, and discard. Now dry out the baby. Then put on the baby's shirt, mittens, bonnets, and booties. Now after that, put the baby on the crib. Now put on the baby on the crib and provide direct light, then attach a name tag. Now application of crib prophylaxis. Shade newborn's eye from the light and open wound eye at a time by inserting gentle pressure on the upper and lower lid. Now apply an ointment from inner to outer canthus of the baby's outer inner and outer canthus, making sure that the tip of the medicine tube will not touch the eye of the newborn. Alright, so now I am going to take the heart rate and respiratory rate of the baby. After doing the procedure, perform aftercare of the equipments used and also perform hand washing to avoid infection and contamination. So for the documentation of the immediate newborn care, document the procedure done and include the weight of the newborn, which is 7.5 pounds. The heart rate is at 120 beats per minute and respiration rate is at 30 breaths per minute. Temperature is at 37 degrees Celsius. So the head circumference is 17 centimeter. Chest circumference is 34 centimeter. The abdominal circumference is 26 centimeter. And the length of the newborn is 43 centimeter. Thank you.